Another question I got asked today was the transitioning of your therapy, your traditional therapy. So, say you've done NLP or you've done the clinical hypnotherapy, which a lot of the therapists have done in the course. They want to know, how do I transition from what I've learnt, whether it's coaching, CBT, NLP, as I said, all of those traditional ones that you've learned, how do you transition from that to advanced conversational therapy? It's easy. Just do it. You can naturally start the session and go into the session with asking them what's the problem. And in the course, you'll see these demonstrations, you'll see how to set it up. You don't need to utilize all the things that you have learnt. I'm not saying that you might not do it, but here is the thing. Once you do advanced conversational therapy, you won't need to rely on that, and it will be so much easier and so much relaxed that when you start using your inquisitive mind, you actually start feeling more comfortable without having to use any of the techniques. You transition with it by just starting it, by just asking the questions, being present with your client, seeing what their reaction is, seeing their responses, what are they saying, and you'll notice what is actually the symptoms, what not to worry about, what you just need to not engage in, because a lot of your clients' things are all going to be symptoms anyway, and you need to get into the root cause. So watching out for those moments where you need to utilize what they're saying to you is about listening. So really listen and engage. And what I've done in the past is I have just had phone calls. Sometimes when I do the strategy call, I won't have a video. I'll just listen to them, and you can start picking up those sensories of listening, of how they're talking, what they're saying, and you actually become more experienced with what the words they're saying. So I would say to you, when you want to transition from your traditional therapies, your modalities, is to start with the conversation. Start with doing advanced conversational therapy. There's no transition. You don't have to prep. You don't have to start doing research on their problem. You don't have to do any of that, because all that is just their best guess on what their problem is. And they've probably seen a lot of therapists, or they've probably Googled and done their own research. And we all self-diagnose. We all say, oh, I've got that. I've got depression. I've got anxiety. I've got, narcissism. Whatever the case they think that they have is not the issue. So don't feel like you need to use that modality, because what you're doing with advanced conversation is getting into the issue. So if you're transitioning from what you've learned, I just advise you, start doing the advanced conversational therapy. It becomes so much easier, and you get so much more of a quick result with it.